Welcome to the Forgotten Trimester, a channel dedicated to the education of women on all things postpartum. On this episode of the Forgotten Trimester, I want to talk about something called postpartum preeclampsia. You will learn exactly what postpartum preeclampsia is. You'll learn the signs and symptoms of postpartum preeclampsia and what to do if you have them. I am Dr. Megan Gray. I'm a board-certified OBGYN and mother of 2 littles. So let's start out with what exactly postpartum preeclampsia is. As the name says, it is preeclampsia that's diagnosed in the postpartum period. So then what exactly is preeclampsia? Preeclampsia is a condition that is only seen during or right after pregnancy. It is a condition that occurs when the placenta adheres abnormally to the uterine lining. This abnormal adherence of the placenta to the uterus results in a cascade of events that causes something called vasospasming of the vessels. Vasospasming is, think a muscle contracting and relaxing over and over and over again, just constantly contracting and relaxing. The constant contracting, relaxing, or vasospasming of the blood vessels causes an increase in blood pressure. This increase in blood pressure along the blood vessels affects the brain, the heart, the lungs, the kidneys, and the liver. So all the end organs, all the most important vital organs, high blood pressures will affect. So what does that mean for a mom? In a nutshell, postpartum preeclampsia puts new moms at risk for seizures, strokes, heart disease, lung disease, kidney disease, or even death. Preeclampsia in the postpartum period can be a very serious condition. In fact, hypertensive disorders in pregnancy cause approximately 7% of the mortalities during and after pregnancy. Preeclampsia is one of those hypertensive disorders, and a good number of them are diagnosed in the postpartum period. It's very important to know the signs and symptoms to look for so that if you have those symptoms, you can get help as soon as possible. So what are the signs and symptoms that you are looking for postpartum preeclampsia? First and foremost is high blood pressures. What is considered a high blood pressure after delivery? So anything where the top number of the blood pressure reading is 140 or greater, or the bottom number on the blood pressure reading is 90 or greater, is considered high. So if you see that after delivery, that is abnormal and it needs to be evaluated. So this is the number you're looking for. 140 over 90. You can have one, either the top or the number, or you can have both. It doesn't matter, one or both. Those are considered abnormally high and should be evaluated. Blood pressures between the 140 to 159 on the top, 90 to 105 on the bottom are considered mildly elevated blood pressures. When the top number is 160 or greater and or the bottom number is 110 or greater, that is considered severely high blood pressures. At that point, women are at risk for strokes and significant damage to other organs such as the heart, the lungs, and the kidneys and the liver. So it is very important that if you ever see a blood pressure 160 or greater on the top, 110 or greater on the bottom, that needs to be evaluated immediately. Do not wait, notify your physician. So the number that you're looking for, once again, for severely high blood pressures is 160 over 110. Write it down. Another common symptom associated with preeclampsia is headaches. So if you have delivered and you start having a headache and you don't routinely get headaches, this is a new type of headache, you take some Tylenol or some ibuprofen and the headache doesn't seem to go away, even if it's mild, it's just this underlying annoying headache. That needs to be evaluated. That can be a sign of preeclampsia. So do not wait at home. If you have a headache and you don't routinely have headaches, you need to be evaluated. So say you routinely get headaches and you have a history of migraines, and so you're not surprised that you have a headache after delivery. But normally your headache goes away with Tylenol or ibuprofen, and this headache doesn't seem to be going away. Needs to be evaluated. It can be a sign of preeclampsia whether you have a history of headaches or not. If the headache is not going away with Tylenol or ibuprofen, it needs to be evaluated. Or if you routinely get headaches or history of migraines and all of a sudden you have a strange headache, a headache that's way different than the headaches that you normally get, that needs to be evaluated immediately. That also could be a sign of preeclampsia. A third sign of preeclampsia is visual changes. So some women will experience spots in their visual field. Some women will actually have absence of parts of their visual field, so they can't see the outside edge of their visual field or the upper edge of their visual field. So that is all considered abnormal. If you're having visual changes, that needs to be evaluated. It can be a sign of preeclampsia. Do not wait at home. Do not wait to see if it goes away on its own. Please contact your physician. A fourth sign of preeclampsia is belly pain. So some women, when they have preeclampsia, will have belly pain up in the right upper part of their belly, up underneath the right rib cage. It's not necessarily associated with eating. It doesn't improve with food. It doesn't worsen with food. It's kind of a chronic, annoying pain. Some women describe it as sharp. Some women describe it as dull aching. It can be associated with nausea and vomiting. It doesn't always have to be associated with nausea, vomiting, but if you're having new onset belly pain in the right upper belly, that should be evaluated. Don't wait to see if it goes away. Call your physician, let them know. That may be a sign of preeclampsia. A fifth sign of preeclampsia could be chest pain or shortness of breath. So if all of a sudden you're starting to have chest pain, like an elephant sitting on your chest, or difficulty breathing, like you're getting squeezed or you can't take a deep breath, that can be a sign of preeclampsia. It could be a sign that the heart and the lungs are being affected by preeclampsia. So please, please do not wait at home for those symptoms. If you're starting to have chest pain or shortness of breath, please call your physician immediately. Go straight to the emergency room or L&D triage to be evaluated. That can be a sign of worsening preeclampsia that's affecting the heart and the lungs. A sixth sign of preeclampsia that I always just add in with my patients as a general guidance is a vague sign. I just don't feel right. I've had multiple patients come in and say, something just doesn't feel right. And so when they're evaluated, sure enough, it's preeclampsia. So if something just doesn't feel right, if you just don't feel right, please go in and be evaluated. Just call your doctor. They'll have you come into the office to be evaluated, or they'll send you to triage, L&D triage, to be evaluated. Don't sit at home and wait and wonder. If something doesn't feel right, if you don't feel right, call your physician and let them know. So obviously you notice throughout the entire spiel of what are the signs of preeclampsia that I mentioned, with almost every sign you need to call your physician and be evaluated. So like I said, preeclampsia can be a very serious condition in the postpartum period. It can lead to significant morbidity and mortality for women. One of the reasons that occurs is because it goes undiagnosed. A lot of women will explain away their symptoms. Oh, I'm tired. Oh, I just need to eat something. Oh, I need some caffeine. All of those can kind of explain away headaches or just not feeling right or belly pain. But if you're having those symptoms, they should be evaluated. So for blood pressures in the severe range, so once again, 160 on the top, 110 on the bottom or greater, that needs to be evaluated immediately. That should not wait. So if you have a blood pressure that you notice either in the hospital or at home of 160 over 110 or greater, it needs to be evaluated immediately. So at home, you need to go straight to the ER, call your physician on the way to the ER, let them know you are going so that they can call ahead and let the ER physician know to be aware of you. This needs to be managed immediately because this puts you at significant risk for complications such as stroke and seizures. For blood pressures that you notice that are in the mild range, so just around the 140s over 90s or greater, these blood pressures can be managed as an outpatient depending on if you have any other signs or symptoms or if your lab work is abnormal. So if you have blood pressures in this range, you need to notify your physician. Your physician will probably have you come into the office. They'll recheck some blood pressures, they'll check some lab work, and then they will probably, if everything checks out okay, have you go home and check your blood pressures at home throughout the day, at least twice a day, and notify your physician for severely high blood pressures, or if you start having any kind of symptoms that we discussed earlier. So the takeaway from this episode is what to look for postpartum preeclampsia. Know your numbers. A blood pressure of 140 on the top or greater, 90 on the bottom or greater is considered abnormally high. It needs to be evaluated. Do not wait at home. Headaches, visual changes, belly pain, nausea, vomiting, just not feeling right, chest pain or shortness of breath. All of those are signs and symptoms of preeclampsia. They need to be evaluated. If you're experiencing any of those symptoms, please call your physician immediately. So that does it for this episode of The Forgotten Trimester, all about postpartum preeclampsia. Certainly, if you have any broad questions, please drop them down below. If you have any specific questions about your health, please contact your physician. I look forward to seeing you on another episode of The Forgotten Trimester. Thank you so much for your time. See you later. Bye-bye, Mama.